I'm Ryan. I'll be your student physical therapist for today. We're going to be starting out, and I'm going to test some of your reflexes in your lower extremity, okay?
Sounds good.
So first one, I'm going to do the great toe reflex. I'm going to flex your big toe, and I'm going to hit the reflex hammer at the extensor pollicis longus to test if you have any extensor reflex. So there is no reflex, but sometimes it's not. Sometimes it's absent and it's not there, which is completely normal. If it wasn't absent, then it would be hypoactive, meaning that there would be lower motor neuron damage. So the second one we're going to do is the patellar reflex, which is at the patellar ligament. The patient's going to be seated at the edge for the great toe reflex as well, and the patellar reflex, and the therapist is going to be sitting on the same or opposite side to test for both as well. So I'm going to go ahead and place my hand on top of the quadricep in order to test this, to stabilize it, and then I'm going to go ahead and hit the patellar ligament right above the tibial tuberosity. So there is a reflex. It looks perfectly normal, not hyperactive or hypoactive. So for the next reflex, I'm going to go ahead and do the Achilles. So I'm going to go ahead and hold the ball of the foot. I'm going to be on the same or the opposite side of the patient. The patient's going to be seated with their legs bent for this one as well as the other two. I'm going to go ahead and tap the back of their Achilles, and they should plantar flex. So that's perfectly normal. There's no hypoactivity or hyperactivity in that as well. So for the last one, this one's going to be a pathological reflex and sitting as well. This one's going to be called ankle conus. There's no reflex hammer. So they're going to be seated. I'm going to hold the back of her leg, and she's going to be completely relaxed, and then I'm going to dorsiflex forcefully and see if there's any bounces or anything in plantar flexion. Relax. So there are no bounces, so it's perfectly normal. So now I'm going to go ahead and have her in prone, the patient in prone position, and then I'm going to be over using the hammer as well for the medial hamstring reflex. I'm going to locate the medial hamstring tendon and use my thumb to palpate it and hit my thumb to see if there's a reaction in the hamstring. With the knee slightly flexed. The therapist is usually behind on the side of the leg. And for the lateral, same thing. It's going to be on the side, behind the leg. And you're going to go ahead and keep that leg bent and flex. Locate that lateral hamstring and hit your thumb. And both were completely normal, meaning that there was a contraction in the hamstring. And then now the patient's going to be in supine for Babinski's sign. The therapist is going to be at the end of the foot being tested. You're going to take the hammer, the end, and you're going to take it from the fifth metatarsal to the forefoot to see if there's any flexion in any of the toes. And there was flexion in all 5 toes. Meaning that it is normal. Okay, so we're going to go be doing some manual muscle testing today.
Just say it again, because I feel like, or I'll just start supine and be like, just kind of say okay, and then I'll switch.
Okay, so I'm going to go be doing some manual muscle testing today. I'm going to go ahead and start with you raising your legs so we can test the tensor fasciae lata. So go ahead and internally rotate your foot for me. Good. I'm going to go ahead and stabilize at the other side of the pelvis. And I'm going to go ahead and push down, go resist. Good. Let's create 5. And then go ahead and rest. And now go ahead and lift up and externally rotate the foot. Good. And we're going to go ahead and test iliacus and psoas major. Keep my hand at the contralateral aces. Go ahead, press down. Good. That's also a 5. Okay. And now go ahead and lie on your side for me. And go ahead and lift this up. We're going to go ahead and stabilize at the knee. And we're going to do adduction. So go ahead and lift this other leg up for me and resist for me. Good, that's a 5. And go ahead and rest this one. And go ahead and lift up, go into slight flexion at the hip and internally rotate the foot. We're gonna go ahead and test gluteus minimus. And I'm gonna go ahead and stabilize at the hip and press down. Good, that's a 5. Go ahead and lift up again. I want you to externally rotate the foot this time while I still stabilize at the pelvis or the hip. And go ahead and press down. And then we're gonna go to slight extension at the hip. Press down, good, that's a 5. Good. So you go ahead and go prone for me. Go ahead and bend your knee into flexion. Go ahead and kick towards the ceiling for me. I'm going to go ahead and stabilize at your back and your pelvis. Go press down for gluteus maximus. That's a 5. Good. And one more time on a supine for me. We're going to go ahead and test the sartorius. Go ahead and straighten both legs. And then go ahead and bend this one for me. We're going to abduct, externally rotate. Great. And I want you to go ahead and resist my downward force towards me. Good. That's a 5. Okay, so go ahead and seat for me. Go sit up. So now we're going to go ahead and test hip internal rotation. So you go ahead and externally rotate your leg. Good. And go ahead and try to internally rotate. Good, resistance, that's a 5. Now go ahead and we're going to try internal rotators. So go ahead and externally rotate for me. Good resistance, and that's also a 5. How's it going, Gary? So we're going to take some goniometric readings for passive range of motion.
All good.
So starting out, we're going to go ahead and palpate the greater trochanter because that's going to be the axis of rotation for flexion and extension. And then the stationary arm is going to be the midline of the pelvis, and the moving arm is going to be the lateral epicondyle of the femur. So go ahead and start lifting for me, and then I'll take over. Perfect. So we got 103 degrees of flexion, which is below the normal. And then next we're going to do abduction. So the axis of rotation is going to be the ACIS on the same side, and the contralateral ACIS is going to be the stationary arm, and the midline of the femur is going to be the moving arm. So I'm going to pick up here, I'm going to move it for you. And flexion is going to be a soft end feel, whereas abduction is going to be a firm end feel. So it's going to be 45 degrees, which is over, which is good. And then we're going to go do adduction. So we're going to move this leg over a little bit. And it's going to be the same as abduction for the axis of rotation, stationary arm, and moving arm. So I'm going to go pick it up here. I'm going to go ahead and move it in. Good. So it's going to be 15 degrees, which is lower than the average, which is 20. So we're going to pick up here. So I'm going to flip on your belly for you. So now we're going to be measuring extension. So we're going to palpate the greater trochanter again. Stationary arm, midline of pelvis, and moving arm is going to be the lateral epicondyle of the femur. And then I'm going to go ahead here, go ahead and lift for me, and I'm going to go take over. Perfect. And it is 20 degrees, which is normal. Okay, so go ahead and sit up for me. So now we're going to be measuring external rotation of the knee. So the external rotation is going to be at the patella. The moving arm is going to be with the lower leg, and the stationary arm is going to be perpendicular to the floor. So now I'm going to go ahead and move his leg inside. Perfect. And the reading is 35 degrees, which is below normal. And then we're going to measure external rotation or internal rotation. So we're going to go the other way. Good. And that was 20 degrees, which is below normal as well. Great.